I see far too many children who end up in the OR because they have to have restorative work and they have 20 cavities and they need 4 caps.
Local doctors and dentists weigh in on the debate over fluoride in the public water supply. The Secretary of Health and Human Services, Robert F. Kennedy Jr., has linked it to a slew of health concerns. He's putting together a task force to study the possibility of banning it from being added to public water supplies. But as Newsroom NBC investigative reporter Jennifer Lukey shows us, some top medical experts say the benefits far outweigh the concerns.
The Monroe County Water Authority has been adding fluoride to our water supply for decades now. It's tested daily, reported to the state to ensure that it remains within the approved levels.
A majority of doctors and dentists and the organizations that represent them say fluoride prevents cavities, reduces oral health disparities, and saves money for everyone. But it has to be the right amount of fluoride.
Fluoride in large amounts is not healthy and not good for the children. And so when you have very little control over when and how they get it, that can be a problem.
Dr. Kathy Goodfellow is a local pediatrician. She says allowing fluoride in the water supply is a good way to make sure a child's intake is regulated if the child actually drinks water from the faucet.
I see far too many children who end up in the OR because they have to have restorative work and they have 20 cavities and they need 4 caps and they need, and it takes them literally a year to get that all done.
The state of Utah recently became the first to ban fluoride. Other states are considering it, and hundreds of local communities across the country have banned adding fluoride to public water supplies, citing concerns over whether it leads to health issues and lower IQs in children. Locally, the village of Albion in Orleans County is currently debating the potential of removing fluoride from its public water supply.
So for now, the Monroe County Water Authority continues to add fluoride into our water supply. To make any changes, it would need state approval. Jennifer Lukey, News 10 NBC.
In addition to fluoride, Jen spoke with local doctors today about the vaccine hesitancy they've been seeing from parents since the pandemic. She'll get into that coming up new at 5. Let's go in depth now on the fluoride debate. In January, a review of 47 studies was published in the Journal of the American Medical Association Pediatrics. The review found a significant association between higher fluoride exposure and lower IQ scores in children. It's important to note the authors of that review say those studies were low-quality studies done outside of the United States. Fluoride levels outside the U.S. tend to be much higher.